this time we are still talking about the circulatory system. We're talking about blood, and we're going to look at platelet production. Here we go. So platelet production, we call it thrombo. So anytime you see thrombo, think clot, right? So clot. So thrombopoiesis. So it's triggered or is initiated by thrombopoietin, which is a biological chemical that signals these stem cells to become mega big karyoblasts, right? So they're always going to be putting their little feet, their pseudopodia, into the sinusoid capillaries and the bone marrow, and they're going to be breaking off those little teeny tiny pieces of platelets, essentially, right? Things about them is they are able to replicate DNA without dividing. And that means that they can form these super huge cells with multiple nuclei. So they can just really pump out the proteins, right? Megakaryocytes are enormo. They are 100 micrometers in diameter, and they're always going to live in the bone marrow, right? They're not going anywhere else. So the little feet or the tendrils, the cytoplasm tendrils, are going to be protruding into those blood capillaries. Sinusoid capillaries is what they're called because they have big, like, lesions in them for them to stick their feet into. And as the blood flow flows, they break off these little finalized platelets, which are going to have all those granules and, be able to initiate clot formation and wounded tissue repair. Platelets will float around for a good almost week, just under like a working week, right? 5 to 6 days. And there's a lot of them actually stored out in the spleen, so 40% you would find there. So here's what we're looking at for hemostasis. So this is basically what would happen. So you would imagine like there's like a blood vessel here, and for whatever reason, you gotta cut a blood vessel injury. And this is the epithelial, like this is the skin essentially of this like tiny little capillary, their blood vessel. So what happens is like all of these little tiny fibers are going to protrude into the cavity of the blood vessel itself. And so like these tiny little platelets, once they come in contact with these tiny fibers, they actually become activated and they start sticking out little spikes. And those little spikes allow them to grab onto each other and to grab onto all of these little protrusions, and it helps form a platelet plug. After that platelet plug is formed, the activation of fibrinogen into fibrin, are these duct tapey fibers, right, are going to come along or be activated, and they actually help seal and secure that blood clot as well as to push it down and flatten, right? So the first part is going to be vascular spasms. So this is the most, what we call immediate protection. It's the first thing we do. And so what happens is when the vessel is broken, all of these little fibers are sticking in. That's going to be what activates some of these release signals, such as serotonin, which is a vasoconstrictor, to actually go, from, oh no, we have a lesion right here, to a constricted kind of conformation, right, to stop so much blood loss as we go through. Okay, platelet plug formation. So the endothelium, or the inside lining, right? Remember, here's like, blood vessel. So here's the outside. We're talking about the endothelial layer, like the lining on the inside. Is normally coated with what we call prostacyclin, and that is something that keeps platelets just inactive, really, is what I would say. And so it keeps the platelets just flowing along in the cell. That's really what it is. And so what happens is those fibers, when we do have a lesion, right, when we do have a cut that come out, are collagen fibers. And when a platelet comes into contact with a collagen fiber, it activates, right? It turns it on and makes it have all these spicules that start sticking out. So the platelet pseudopods are going to stick to the damaged vessel, right? So these little protrusions are going to grab on and start sticking. And the more they stick to the damaged vessel, the more they also stick to other platelets, right? And it becomes this larger growing clot altogether. So they're going to contract eventually and form what we call a platelet plug, which is like an early version of a scab. Eventually, they're going to release their granules and spit out all of their chemicals, which are going to include things like serotonin, the vasoconstrictor, ADP, which is going to attract, as well as activate some platelets to spill more of their granular guts. And also a very important one is thromboxane A2. And so what this does is this promotes more platelets to come together and release more of their signal chemicals, and which will eventually, of course, make that vessel constrict even more. So really just kind of this like steamrolling set of events, right? It's what we call a positive feedback cycle. So the more we're kind of rolling into it, the more we're going to kind of be ramping up. So clotting or coagulation is the last step, and it's the most effective it's where we're trying to get to, right? So we can stop any bleeding. And what that does is we have these little like plasma proteins that are kind of floating around. They're like packed with like fibers, right? But they're in the packaging, so they're not, extended or anything. And this is fibrinogen. And so what happens is it allows fibrinogen to pop out all of these threads so that we can use them to duct tape down that clot and also like compress it as well. So they become those fibrin threads. Procoagulants are what we call clotting factors. So pro, moving forward with the process of coagulation, present in the plasma, hopefully, yep, they're always there. Produced by the liver along with like so much liver. Thank you so much, liver. You are just out there working for us. And they cause and react to a reaction cascade, meaning like one thing leads to another, leads to another, leads to another, leads to final product. Okay. All right. So before I get into pathways of coagulation, I just kind of want to end that here. And so I hope that was pretty helpful. And I also hope you're having a great day. Bye.